The National Coalition for Cancer Survivorship advocates for quality cancer care for everyone touched by cancer. Founded by and for cancer survivors, NCCS defines someone as a cancer survivor from the time of diagnosis and represents the millions of Americans who share a common experience, living with, through, and beyond a cancer diagnosis. In Cancer Convos, NCCS talks with survivors, advocates, caregivers, providers, and health policy experts about survivorship, advocacy, and public policy. For more information about NCCS, visit our website at canceradvocacy.org.
Hello, I'm Shelley Fuld, Nasso, CEO of the National Coalition for Cancer Survivorship. Today I'm talking with three amazing women about their experience living with cancer during the COVID-19 pandemic. My guests today are Janet Freeman-Daily, Sheila McGlown, and Kelly Shanahan. Janet, Sheila, and Kelly are all living with cancer and continuing their tireless advocacy efforts during the pandemic. I'm going to let them introduce themselves and share more about their cancer background and experience. Janet, let me start with you. Can you tell us about your background?
Sure. Thanks for inviting me. I am a lung cancer patient activist. I was diagnosed in May 2011. With advanced lung cancer. I went through curative chemo and radiation, and my cancer progressed. I went through more chemo and radiation, and my cancer progressed again. But because I was active in online patient communities, I learned about clinical trials and genomic testing of tumor tissue. I arranged to get my tumor tissue and was found to have a genomic cancer driver called ROS1 and got the last slot in a clinical trial, which I joined in November of 2012. I have been on that drug ever since with no evidence of disease for 7.5 years. So now I am a full-time cancer patient and activist in a variety of topics.
Great. Thanks so much for joining us, Janet. Now, Sheila, would you introduce yourself?
Hi, my name is Sheila McGlown, and I'm a 25-year Air Force veteran. I have been living with metastatic breast cancer for the past 10 years. I was diagnosed in 2009, and I do want to say that my mom passed away in 2004 of metastatic breast cancer, and 5 years later, I received the diagnosis that it had spread to my liver and ribs. I'm currently on a clinical trial, and I've been on a clinical trial since July of 2018, which I'm doing well on. And my platform is to end health disparities in the African American community, while also encouraging researchers to recruit Black women when they are for clinical trials, because Black women need to be included. Right now, like I said, I'm doing really well on this clinical trial, so I'm happy to be on it. And I'm just blessed that my doctor found a clinical trial for me.
Great. Thank you so much, Sheila. So, Kelly, would you like to introduce yourself?
Thank you, Shelley, for inviting me to be here with these other amazing advocates, and I include you in that. I'm Kelly Shanahan. I have been living with metastatic breast cancer for 6.5 years. Like 20 to 25% of people with a breast cancer diagnosis, I was first early stage, diagnosed in 2008, and diagnosed metastatic in 2013, ironically, on my birthday. I don't recommend getting scans on your birthday. I used to be an OBGYN in private solo practice in Lake Tahoe, California. Permanent neuropathy cost me my career, but I keep very busy with advocacy now. I'm a full-time unpaid patient and advocate, and I'm currently on the board of directors of METAvivor.org.
Thank you so much, Kelly, and thanks to all of you for joining us. So I really just wanted to have this conversation with all of you to share with our listeners, really, what is it like to be in treatment for cancer during a pandemic? And have you had any delays in or changes to your treatment as a result of COVID-19? So who wants to go first?
I could go first. This is Sheila, and I haven't had any delays, but I have had to make some changes, like no visitors in the treatment center. And my last, for 3 hours, I usually have to wait to get more blood work to check my heart, but they did away with that, during when it first started. So those were really the only changes. I have to see my doctor, so I can't see her through computer. So it's a lot of things that I have to do because of the clinical trial. So that never stopped. But, it's you get so worried because I went in, I was like, well, I think I sneezed, and my doctor just looked at me and was just like, no, Sheila, you're okay. And I'm just like, okay, I'm just kind of nervous. You're around people in the hospital, you got to sit, and you're around the nurses and stuff. So I guess I was just more cautious and more, not so much nervous, but just, I guess I would say more cautious.
Mm-hmm. How about you, Kelly?
I am lucky enough that I am on only an oral medication and have been stable on this oral medication for about 5.5 years now. So I have not had any changes in that I don't have to go to a center for treatment. I did reschedule visit I was supposed to have with my metastatic breast cancer expert doctor in San Francisco in March. We've moved that to August, and I wouldn't be surprised if we change that to a telehealth visit. I'm supposed to see my local oncologist at the end of June. And again, I think we'll probably move that to telehealth. I did postpone getting labs done because I live in a small community with a small hospital, and I didn't want to place an undue burden on my healthcare system. But I am going to put on my big girl panties and go get labs this week. I'm going to, basically going to tell them, like, throw the tubes out to me, I'll draw it myself. The one thing that really was impacted is I have extensive bone metastases and was receiving physical therapy, which made a huge difference with my discomfort. And I haven't been able to go get physical therapy since February because they basically canceled all outpatient appointments. And that's had a big impact on my quality of life to not be able to get physical therapy, to not be able to get my regular massages. I live in California. We are still under shelter in place orders, and massage therapists are not yet allowed to be open. So I'm looking forward to being able to resume these quality of life services that have been impacted by the COVID-19 pandemic.
Great, thank you. And Janet, how about you?
So I also take an oral medication. The difference is my oral medication inhibits the cancer but does not kill it. Pretty much everyone who's taken this has eventually had their cancer progress. I'm one of the outliers. And just last year, my oncologist decided that I could go to scans every 6 months once I left the clinical trial. So that was a little nerve-wracking, but I was willing to accept it. My last scan had been in December. And my oncologist is the clinical trial oncologist. Now, I've got a very rare cancer, and the clinical trial site was only open in 3 locations in the US. So I go see one of the experts in my type of cancer who happens to be in Denver, 1,000 miles away from me in a different state. I, in between, want to see my local doctor. So every 3 months, somebody does labs, and every 6 months, I get scans. My labs were scheduled to be March 23rd. In February, I came down with a bad dry cough. And I tried to get tested for COVID, and nobody was testing at that point anywhere. The CDC hadn't even released the tests yet. By the time tests became available, I didn't have symptoms, so I didn't qualify to get tested. As far as I know, I don't know if I've had COVID or not. But because I had a cough, I was not allowed to go to my appointment in March to see my doctor. It got canceled, and they weren't set up for telehealth at that point. I ended up seeing him later because I started having some concerning symptoms. I have, thanks to my cancer, blood clot in my pulmonary artery, and we've been tracking that, and heart problems because my radiation hit near my heart. So when I had some symptoms that came up, they wanted me to come in for scans. So I ended up going into the hospital, and they wanted me to wear a mask, and they checked me for temperature, etc. And while I'm standing in this queue of patients waiting to get all these checks, I see a security guard breeze past me with no mask. While I'm sitting in the oncology department, I see somebody with a hospital badge walking through in front of all the cancer patients with no mask. And I'm thinking, well, this is interesting. So I got my results on the online portal. My doctor didn't do the telehealth to consult with me. So my appointments were really different that way. And it's going to be even more different because later this month, I was supposed to have my 6-month appointment with my doctor in Denver. Well, I'm not going to fly to Denver. I'm not flying anywhere for the rest of the year, at least. But I also can't do telehealth with him because Colorado and Washington State do not have an agreement that a doctor licensed in one state can practice in the other. So I can't see my regular doctor. So COVID has had an impact on my care.
So this is Kelly. I think that's crazy because one of the things with COVID is that some of these limitations about practicing across state lines and doing telehealth were supposed to be waived. And you're not the first person that I've heard that has said this.
It was waived for Medicare patients, but not for patients who aren't on Medicare.
Interesting.
Private insurance companies make their own policies. My private insurance company is willing to do it, but the states have to agree that the doctors are licensed, and Washington State has not.
Wow, I actually didn't realize that. I knew that the requirements were waived for Medicare. And as Kelly knows, NCCS is working on a project right now really to get patient perspectives on telehealth and how do we make sure that telehealth benefits cancer patients, because there's been this rapid, uptake of telehealth due to the pandemic, but we want to make sure that patients' voices are heard. And we've been doing focus groups, and Kelly's part of a steering committee that we have to help it bring the patient perspective to telehealth. So that's a really important kind of gap in the policy that I think needs to be addressed. So thank you for highlighting that, Janet.
Another aspect is that the average age for lung cancer is 71. So we have a lot of older patients, and there's a lot of them that do not either have the technology available or do not have the ability to use the technology to access telehealth. So I'm hearing concerns from older patients that they don't know how to talk to their doctor right now.
And that is a concern. Medicare has recently started paying for telephone visits. I mean, they used to never pay for telehealth with video capability. And, now because of some of the issues that have been raised about people who either don't have access to video capable telehealth, they're now starting to cover telephone visits, which is it's not ideal, but certainly it expands the capability. I know recently I have a daughter that just graduated, and you can't see me using the air quotes, from college. And it took me 45 minutes the day before we did a Zoom little celebration with my daughter 500 miles away and my 93-year-old mother 2,500 miles away. It took 45 minutes the day before to walk my mom through how to do Zoom, and still had to kind of go through it. So that, that's something that's going to need to be addressed. And maybe one of the things that will come out of this is allowing for these type of visits to make things easier for patients with, a mobile health provider going and getting vital signs or things like that. So there's, there's opportunities with this pandemic. And one of the opportunities that I hope arises is that there's flexibility, taking into account what the person with cancer wants to do, whether it's in-person visits or whether it's telehealth or whether it's some sort of hybrid.
There's also, I would think, issues with disparities for access to telehealth. I'd like to hear what our disparities advocate has to say.
Well, Kelly, I agree with you on that. Well, I was just thinking, I go to Siteman Cancer Center in St. Louis, Missouri. They just built a brand new hospital, like maybe 5 minutes from me. But because it's in Missouri where I go, and where I live at is in Illinois, I can't go to that hospital. So I have to travel all the way to well, not all the way, but it's like 30, 35 minutes to St. Louis just to get, because my thing is, why can't I get my EKGs on my scans on this side and have you transfer them over to the Missouri side? But because they said the laws are different, I have to still go over to St. Louis. So I'm just thinking for patients, even for communities, underserved communities where I'm at, how are they? Are they going to the doctor, or are they just saying, hey, just, I'll just have to wait it out? Or are they doing telehealth? Or, a lot of patients, like you said, don't have the internet or access to, and that's what we're advocating for African American women and men, is access to care, for everything. So, or even maybe transportation to even get to the hospital to get there, with COVID going on and everything. So that's, I guess I never thought about that, but that's something to think about.
And I think this is an opportunity for us advocates to, and Shelley, I know that this is right up NCCS's, alley here to work on national licensing so that physicians can, experts especially in rare cancers and in certain cancer subtypes, can practice across state lines. Because Janet, like you said, your person, there's 3 sites in the country and the closest one to you is Denver. And we should be able to access these physicians that are experts in our particular type of cancer. And again, we can use our voices, I hope, as advocates to push for legislation that will allow this.
And Kelly, this is Shelley. What you said about, we need the flexibility to take into account what each person with cancer wants for their treatment. Because, we can make some broad generalizations that older people may have more challenges with technology. Well, some older people do, some are going to be fine with it. Some younger people may have challenges with technology too. So I think, and what we've been hearing in the focus groups, and I'm looking forward to being able to share it more broadly when we've completed our analysis, but there's a wide variety of opinions and situations when telehealth would be useful, situations when it wouldn't, but it doesn't always break down by age or by what the kinds of things you might expect. Those are definitely predictors, but everybody with cancer is unique and has a different situation and maybe has different preferences for how they receive their care.
And that may change. I live in a ski resort town. So for me, even driving the 45 minutes each way to see my local oncologist is problematic if it's December and there's a blizzard. Or if I had to see him in July and it's the height of tourist season, and the roads are packed. So sometimes as a patient, we might want to see our doctors in person one time, and then another time may want to utilize telehealth. And I think we should have that flexibility. And I think it should be driven, like everything else, it should be driven by the patient.
Sheila, I have a question I want to direct to you, because I know that we know from the reporting and the data that African Americans are hit harder by COVID. And I know you're an advocate for reducing disparities in cancer outcomes, but now we also have on top of that COVID, where Black Americans are really getting hit much harder by this disease for a variety of reasons. How is that? Have you kind of applied your advocacy for cancer patients to COVID, or what do you see as the intersection there?
I guess I really haven't with the communities that I serve in Illinois. I haven't heard of because I asked my doctor the other day about, my last visit about COVID and different things, and she said it's really not a high percentage of people that have COVID, the area that I live in. But I do know, like in St. Louis County, there is a high percentage of COVID cases amongst African American men and women. I just think that just trying to get more. We're having all these webinars, we said we're having all these webinars, we're having all these surveys, and it's not, it's like, what are we getting out of these? Are we attracting the African American community to even talk about COVID and how it's affecting, especially as a cancer patient? It's how are we getting to the communities that aren't, not so much on social media, but how are they learning about how to get better care as far as, COVID and cancer. So that's my goal right now, is to make sure that we get the education piece out there first, and for them to know, for the African American community to know, is to know that, hey, we need to be filling out these surveys. We need, because it's impactful, and we need to know who's affected by this.
Right. Yeah, and I think there's a big difference between patients who are connected to advocacy organizations or who are really empowered patients and have and know a lot about their disease and their care, but not all people are equipped or interested in being that empowered patient. And I think there's a pretty big difference there in how they view the care they receive and then the kinds of information that they have. We did a survey, and we're going to be releasing it in the coming weeks, and there was a pretty big difference between sort of the connected patients and the patients who are, harder to reach, I guess, and because they're not advocates or involved with organizations like you all are or connected on social media.
Well, and Sheila mentioned something else that I think needs to be pointed out. Where you live makes a big difference into how much you're impacted. In the early days when New York City was hit so hard, lung cancer patients could not get diagnosed because all of the surgery theaters had been converted to ICUs and they couldn't do bronchoscopies in order to get tumor tissue and diagnose the lung cancer. So it makes a big difference, the community that you're in. And communities are hit harder than others. So if there's a high number of cases and your hospitals are full, patients may know there's COVID there and they may not even go to the doctor, or they may not want to call the doctor because they're afraid of COVID.
Right.
And then I think that too, okay, so if you say you have COVID, like how many patients would even, if I say I've had COVID, would they take me off my treatment, or will they take me off this clinical trial? Or, I know, are African American patients, when they have symptoms and stuff, are they going to the doctor to say, hey, I have symptoms? Because, around here, I'm pretty sure most cities do have, but we have testing sites like almost everywhere, it seems like. And it's just like how many, would be scared to even just say, hey, I'm having these symptoms, but I'm also scared they might take me off of my treatment for cancer. So, like I said, it's all about the education piece, and it's up for me as a Black woman to say, hey, to educate my community both on COVID, best as I can, and both be the best, I guess, cancer advocate that I can be.
And there's been some recent work, on COVID and cancer, and the COVID and Cancer Consortium, otherwise known as CCC19, just published a paper in The Lancet with some international data showing that people with cancer that are infected with COVID have a mortality rate of 13%, which is double or more what it is in people who don't have cancer. And Janet, I know you're involved with TerraVolt, which is a similar consortium specifically related to lung cancer patients. So I'd love to hear some thoughts from the lung cancer community about COVID.
Yeah, there's considerable concern in the lung cancer community. When we first started hearing about COVID-19 in China, some of the very preliminary information showed that it was worse for cancer patients or people with underlying health issues, but it was particularly bad for lung cancer patients, which makes sense because this particular virus goes to receptors that are very plentiful in the lungs and causes considerable problem in the lungs. The TerraVolt study that was released in ASCO, I don't have the numbers in front of me, but it's like 3 times worse in lung cancer. I think the deaths, if you contract COVID, you're much more likely to have a severe case if you have lung cancer, and there's like a 35% of them die, which is scary. One of the issues that came up in the lung cancer community arose when hospitals who expected to be overwhelmed or were overwhelmed started talking about policies for triaging patients. If they don't have enough ventilators, how do they decide who gets them? And a lot of the policies were automatically disqualifying anybody who had lung cancer, which is terrifying.
Or advanced cancers of any type. I know that's something that's, we've seen in our social media circles.
But thanks to activism, I think that they're rethinking some of those and looking at the individual patient's case and not just automatically disqualifying them.
So now that the country is reopening at various speeds, various stages, depending on where you live, how do you feel about that, knowing that you guys being, especially with lung cancer, but having, living with cancer, have higher risk? And what advice do you have for other people living with cancer or feeling the stress and anxiety about seeing things reopen and worrying about what that might mean for them?
Lung cancer patient, I'm fortunate enough that I don't have an essential job that requires me to leave the house. So I'm staying put. I'm probably staying put for a really long time. I happen to live in King County, which was the initial hotspot for COVID-19 in the US, and we still haven't opened up. Even with being closed, there's a few things open like takeout food. And if I stop by a place to do takeout, there's a bunch of people milling around. None of them are wearing masks. I don't want to expose myself to that. So I'm being very careful. People who live in other areas that are starting to open up need to think about what they can do. On the other hand, my son is a worker in a grocery store. He goes to work and he has to. That means I don't get to see him very much except from at least 6 feet away. It's tough, and living with it for long term is going to be a real challenge for me.
Yeah, I mean, all three of us have incurable cancer, and I live in a more rural, small town community, but I live in a tourist town. And we had very few cases, but we had a 25% jump in the number of people diagnosed with COVID-19 in our county, in the Lake Tahoe Basin portion of the county last week. We had tourists coming up here for Memorial Day. They're not wearing masks in the grocery store. The grocery store workers are wearing masks. I don't go anywhere without a mask on. And I've made a decision that I'm not going to any conferences. I'm like Janet, I'm not getting on a plane this year. I'm not nuts. When you have a limited lifespan, that's really psychologically challenging to deal with missing out on things. And it makes me insane that my town, my county, my state, and I have an awesome governor. Janet and I both have great governors, I think, but our governor's not made the decision to make it a statewide requirement to wear a mask in public places. My county supervisors haven't, our city council hasn't, and a lot of businesses are using that as an excuse for why they're not doing the same. And I wish that that our government officials would just grow some gonads and make these unpopular, but from a public health perspective, decisions to protect all of us. And Sheila, you live in a city, so I'd love to hear what it's like for you.
Husband still has to go to work and my daughter still has to go to work. So I have to go out. I have to go grocery shopping and I have to basically still live because, I came here, I was in the military. So all my family is in Ohio. So I'm basically here, with my husband and daughter. And, Illinois, our governor has done a really good job and he's mandated a mask. So when I do go out, I do see a great deal of people with masks and signs on the doors that says you can't come in without a mask. So they're doing pretty good, but it's still kind of like if you touch the card, I'm wiping off the card, is that effective enough? And it's just scary, especially coming after chemo and I want to go get something to eat, it's just all so scary, but it's, necessary because either that or, I'll have, I don't want to overburden my husband or my daughter. My daughter's a social worker. She's saving kids' lives through this, virus and epidemic. But it's just really hard. It's like you said, it's incurable, and it's like, man, I've been living 10 years with this, and now I gotta worry about a virus. It's just so crazy. It's just the fear of the unknown, I guess, for me right now.
Yeah. My daughter's still 500 miles away where she went to college because she doesn't want to come home and risk getting me sick, even though she and her little tiny core group of friends that have been living together through this whole pandemic have been smart. She's like, well, Mom, when I come home at the end of the month, when my lease is up and I have to come home, because I have to quarantine myself away from you for 2 weeks. And that's a kid thinking about this.
It's also interesting seeing what's happening in the larger patient community. There are some metastatic patients who are very sick and they don't know how much time they have, and they don't know how much time they have to make memories with their families. And they're choosing, despite the pandemic, to travel and go places with their families in order to make memories. And on the one hand, it terrifies me, the risk that they're exposing themselves to. On the other hand, you can't live your entire life locked down when you only have perhaps months to live. So it's a really tough choice.
So how do you find support and stay connected when you feel that need to stay at home and isolate from people who aren't being as safe as you? I mean, how are you all coping with that and staying connected to others?
Thank God for the internet. In the first place, again, I live in a small town that didn't even have a cancer support group until a friend of mine and I started one. So I've gotten my support, whether it was when I was dealing with infertility when I was younger, or multiple miscarriages, or being a mom, or having cancer. I have gotten my support from online communities. And the people that I have met online, people like Janet, people like Sheila, those are my close friends, closer than some people that I know in real life. So being able to access these support groups and having Zoom meetings or Zoom happy hours or Zoom bingo or Zoom yoga has been absolutely invaluable. And I know that if I didn't have that, my husband and I would probably have killed each other by now, being stuck in the house. I'm like both of you, I'm frequently traveling for conferences and meetings, and we've all kind of been stuck at home, and it's been invaluable for me to have that.
I have the same feeling. The people that I've connected to through the internet, I've made some terrific friends, and being able to talk to them on Zoom. I have some of them that I'm texting regularly. It just really makes a difference to be able to talk to other people that know what you're going through.
Yeah, and I think the online community has been. I mean, it's like they have stepped up a notch. I go on Twitter because the other day I was just feeling like this clinical trial has me nauseated to the point where sometimes I'm just sitting in a corner crying because it's so bad. But I know I can go on Twitter and Kelly will say something, "Come on, girl, you can do it," or whatever. And this person will say something, and we praying for you, and come on, you could do it. You could. And it's just that positive feedback, that positive energy that not only do metastatic breast cancer patients need it, but just for anyone that needs that positive energy to just get them through the day, especially being in the house for so long. So the Zooms are really amazing. And I just say everybody just stepped up the love and the friendship and the concern and the caring just a notch, and just say, hey, we're going to do this together and we're going to make it out of here together.
While the positive is great, I also appreciate being able to tell somebody else how crappy my day has been and have them say, "Yeah, that really,"
Absolutely.
and I know you know what I mean.
Right. It's important to be able to be real and not have to put on a face that everything's okay.
Yeah, it's nice to have people that you can just go and go, this sucks. And you get all these people going, yep, because it does. Life, there's the good and the bad in life, and we're all in this together, and we're together apart. And I'm glad that we have that community to be able to share good times, bad times, the in-between times with.
I also want to say one other silver lining I've seen of all of this COVID is the amount of collaboration between researchers has just skyrocketed, and it's global. I really hope that continues once the pandemic is over.
Yeah, I hope the silo walls are broken down, because it's made a huge difference in COVID research, and it can make a huge difference in cancer research. And we have to insist that, locking everything up behind your institution walls has got to stop.
Well, and I was going to ask you both about how your advocacy's changed during the pandemic, but also the silver lining. So you guys beat me to that with the silver lining. What other silver linings do you see? And is there a silver lining in advocacy as well, in your advocacy efforts?
Well, in lung cancer, there's several lung cancer advocacy organizations that have some size, and dozens of smaller ones. And we have come together to try and publish evidence-based information for patients about the pandemic. And I think it's the first time we've had this kind of collaboration across the organizations and being so actively involved. That really warms my heart to see it.
And I think just things like last week was virtual ASCO. And while some of us have been lucky enough to go to that meeting, it's expensive. And I think it was open, it was free for most people. And I think it allowed participation. I also love the fact that I didn't have to choose between going to this session or going to that session because everything's recorded and it's archived. And while nothing can replace being in the same room with oncologists and researchers and fellow advocates across cancer types, I think there's definitely some good, and I think some type of hybrid in the future when we are able to gather will be what happens. And so therefore more people are going to be able to access this type of information.
As long as they don't schedule the plenary at the same time as your husband's got a business meeting and the kids are doing homework.
Yeah.
And someone's doing a test online.
but it is archived and you can watch the recorded. I mean, it was all pre-recorded. It wasn't like they were Zooming. It wasn't like a live Zoom type thing. It was all pre-recorded. So you can access it when the kids in school are in bed and when the husband on the conference call is off, or when your internet service comes back on because it's raining and windy and you live in the mountains.
Yeah, and I think it's also allowed people to think outside the box. And it's been really great to see all the new, I'm a part of a new committee that, I don't know, it probably wouldn't have been existed if COVID, everybody's just thinking outside the box and doing more. Advocates are, man, they're through the roof. We're thinking of all kind of stuff that we need this, we need to do this. So I'm just proud to be an advocate right now and proud to be amongst women and men who are just doing amazing work, even through their diagnosis. Their first thought is, it's not about me. I just want to help others, so I'm really proud.
Mm-hmm.
Thank you guys so much for joining me today. I really appreciate you sharing your experience, and hopefully, I think this could be inspiring to people who maybe aren't connected as advocates and want to get involved, because they're hearing from you all about what you're doing and how you're continuing your advocacy during these difficult times. So, can you each tell our listeners how they can connect with you on social media? Janet, how about you?
So I am involved in the lung cancer social media effort on Twitter. That's at LCSM chat is our hashtag on Twitter, but not our hashtag, our handle. But our hashtag for our chats is hashtag LCSM, where doctors are very involved, patients are very involved in tracking the most important information that's come out about lung cancer from conferences. We have chats once a month on the first Thursday. And that is one place you can reach me. I also have a blog at greatconnections.net, and I'm on Facebook under my own name, Janet Freeman-Daily.
Great. Thank you. How about you, Kelly?
I am on Twitter. My handle is at stage4Kelly with the number 4. I'm very involved in the breast cancer social media chat, hashtag BCSM, which is Mondays, 9 p.m. Eastern, 8 Central, 7 Mountain, and 6 for all the cool people like me on the Pacific time zone. I'm on Facebook under my own name, Kelly Shanahan, as well.
Great. And Sheila?
I'm on Twitter at swag, SWAGG, Sheila, SHEILA 1. And Facebook is just my name, Sheila Marie McGlown.
Awesome. Thank you so much for joining us. We really appreciate you and your time and your advocacy.
Thank you, Shelley.
Thanks for having us.
Bye.
Thank you for listening to Cancer Convos. You can find more information about our guests by reading the episode description. On our next podcast, we'll talk with researchers from the National Cancer Institute about the COVID-19 in Cancer Patients Study, or NCCAPS, a 2-year study of 2,000 cancer survivors to better understand the effects of COVID-19 on cancer patients. For more information about cancer advocacy, policy, and helpful resources for survivors, visit NCCS at canceradvocacy.org. To find resources on COVID-19 and what cancer survivors need to know, go to canceradvocacy.org/COVID resources, all one word. Cancer Convos is sponsored in part by the Pfizer Foundation. Thanks again, and tune in next time for more Cancer Convos.